Hi, my name is Jessica and this is my client Carter. I'm going to do a series of range of motion tests and I'm going to start off with ankle plantar flexion. Carter, will you please lie supine on the table? And then I'm going to use my goniometer to take the measurement. The axis is going to be on the talocrural joint, which is right about here. And then the stable arm is going to be on the lateral fibula, and it's going to be lateral to the epicondyle of the knee. And then the movement arm is going to be parallel to the fifth metatarsal joint.
So for the muscle test,
And then I'm going to flex the ankle.
and I'm going to basically have her straighten her leg out. So since we did right, we'll do continue with the right. I'm going to stabilize along her iliac crest.
Okay, and his ROM for ankle plantar flexion is 40 degrees.
And I'm going to push down.
Our next range of motion test is going to be for hip flexion, and Carter will go into the supine position. And I'm going to be using the larger goniometer for this measurement, and my axis is going to be on the greater trochanter, which would be right about here. I'm going to place it there. And then my stable arm is going to be parallel with his trunk. And then my movement arm is going to be parallel with the lateral epicondyle of the knee along the femur. And then I'm going to lift up Carter's leg, and he's going to flex his knee. And then I'm going to stop when I feel a pelvic tilt. And right about there. And his ROM for hip flexion is 121. Now we are going to move on to knee extension, and I'm going to have Carter go in the supine position again. But this time we are going to have his right leg propped up on this box here in order for me to take the knee extension ROM. And then my axis is going to be on the lateral epicondyle of the knee, which would be here. And then my stable arm is going to be on the lateral midline of the femur. And then my movement arm is going to be on the lateral midline of the fibula. And then I'm going to stabilize, and then he is going to extend his knee. And then his ROM for knee extension is 5 degrees, which is the normal range. Now I will be performing manual muscle testing on my client here for hip flexion. And right now he's in the supine position and he's sitting. And then I'm going to be stabilizing his posterior iliac crest, which should be right here. And then this is a gravity maximized test. And then I'm going to have him flex his knee right about there, and I can feel it right here in his iliac crest. And then I'm going to push down on his knee to see if he can hold the position. And I would give him a 5 since he was able to hold the position throughout the test. So now we are going to be doing the hip flexion manual muscle testing for a gravity minimized position, and my client is lying on his side for this one. And then I'm gonna come in and grab his leg and cradle it under my arm for stability, and I'm holding his knee right here. And then I'm going to go in and palpate his hip flexors, and they are right here. And then I'm going to instruct my client to bring this thigh close to his chest. And then I would give him a score of a 2 since I was able to palpate the contraction of his hip flexors and his thigh did move. For this next manual muscle testing, I am going to be doing it for ankle plantar flexion in a gravity maximized position. And then I am going to have my client stabilize using my forearms for balance. And then he is going to lift up one heel off the ground. And then I'm gonna have him attempt 25 reps of rising on his toes on the opposite side. And you can stop there. And for his scoring, I would give him a 4 since he did 11 reps between 10 and 25. And I did start to notice his posture change and I felt more pressure on my forearms as he was completing the reps. But the ones that he was able to do were done in full range of motion. For this next part in manual muscle testing, I will be doing it for ankle plantar flexion in a gravity minimized position, and my client is in the prone position. And I'm going to start by palpating his gastrocnemius and soleus down here, and then I'm going to instruct him to flex his toes on this leg, and I was able to feel a deep contraction. So I would give him a score of a 2 since his toes were flexed and I felt a contraction.